I'm here doing an interview with therapist Eric Bellman on May 31st, 2011. Eric, what is dialectical behavioral therapy?
Um, it's an approach that was written about first by Marshall Linehan of the University of Washington and expanded by Kabat-Zinn and a number of others in cognitive therapy workbooks. It's kind of like a combination of Zen and cognitive therapy, so that we focus on mindfulness. There's really four stages that we want to focus on. One is to relieve immediate distress so that we don't not pushed into dangerous behaviors by our feelings. The second would be mindfulness to recognize what it is our options are and where we're coming from, thoughts that go through our brain. And the third would be emotional regulation to control our actions. Once we do that, that puts us in the moment. Once we're in the moment, we have much more control than somebody that whose brain chemistry or adrenaline responses are pushing them over the edge in one direction or another.
What would you say? What kinds of emotions can you regulate with DBT?
Especially survival mode, PTSD kinds of things, where you have conditioned reactions to intense emotional danger and things like that, and also heartbreak, things that are terrible grief, terrible amounts of grief, and any kind of behavior that is pushed by an emotional reaction where we need to really feel the feelings, express the feelings, and then modify them slowly, like you would turn a graveyard uh, or a battleship in here, forget it.
So, what would you say to somebody who's thinking about doing dialectical behavioral therapy versus traditional psychotherapy?
I think you can combine both and maybe create a whole team where you have one person that's doing family systems therapy, another that's helping them with addiction therapy, a third with bipolar or biochemical responses, and a fourth with dialectical behavioral to help them pull it together and have mindfulness, which works on retraining the brain to break the conditioning, and that's where we empower people, and that's where the healing is.
Is there a certain type of person who is best suited for DBT?
Requires a certain amount of intelligence because you have to be able to communicate to yourself and be aware in of what you're thinking when you're thinking it, which sounds simple, but really most people just are aware of things without really realizing why they're aware of something. So there's a conscious observer self that watches the mind, and it's, in the Buddhists called the guardian at the gate. And basically, you try to keep negative thinking out and stay in a neutral place so you can be clear-minded and respond to the situation in the moment.
Would you say that the type of person that would do yoga and be in a healthy lifestyle would be a good candidate for DBT?
I think those are essential qualities because if you don't do those type of things, then you're going to be so vulnerable to emotional reactions, you're not going to be able to use DBT effectively unless you train very hard for very long. So those are qualities that reduce what we call cognitive vulnerability and reactivity. So if you get a good night's sleep, if you eat right, if you do yoga, you're not going to be as reactive. Therefore, you're going to have more control over your life than if you don't take care of yourself. So there is a holistic process involved here.
Now, is DBT the kind of thing that you can do outside of the therapeutic setting? Is it other activities? Is it similar to cognitive behavioral therapy?
It is similar, but also it's a lifestyle choice, and there are many choices. So the idea is to have options, and so of course it's something that's done outside of therapy because therapeutic relationship is just the incubator. The actual learning of the tools for your toolbox to take down the road in your journey in life is the cognitive tools from dialectical behavioral therapy. So they're always practiced outside the session, and they are actually effective to the extent that we use them, and also again bring in secondary teamwork in terms of reducing addictions, compulsive behaviors, and serious biochemical problems.
And you've trained other therapists how to do DBT. What do you tell therapists and on how to perform DBT that have never used it before?
Well, I've trained other therapists in my particular brand of therapy, which incorporates DBT, cognitive therapies, traditional psychodynamic therapies, and a comprehensive team approach that focuses on a person in a situation. So you can have biopsychosocial sexual aspects to the thing. So it's not strictly DBT that I train other therapists. I train them to view human beings as people in a situations with a whole terrain to look at, a whole geography of many parts of their lives that need to be addressed. And of course you triage and address the most important or most serious first.
And where do you see the future of therapy, and where do you see therapists evolving?
I think therapists always have a function in helping give support to people to learn cognitive retraining. I think that we'll use computers more, and the drug companies are pushing, more and more elaborate kinds of medications, and of course psychosurgeries are getting more popular and so forth. And so for some of the major things like schizophrenia and things like that, and even addictions will have more pills. But they will not be able to replace the human contact because many people suffer from post-traumatic stress and dissociation and things like that from childhood abuse where they've actually skipped whole stages of development. And those you need to be able to address from a humane and client-centered kind of Rogerian approach while at the same time being alert to compulsive behaviors and addictions. So it's an interesting balance that you strike, where you bring to bear all the multivariable understandings and knowledges we have at this point. I think there'll always be a place for therapists because we can reason out in the moment, being zen about the whole thing, what is the most important issue to treat at any given time. And then we can treat that and also help reparent or give the person tools to reparent things. Therapists themselves do very little, but machines and medication can actually do more harm. So I think, there'll be more elaborate ways of treating certain things like uncontrollable tremors, for instance, and Alzheimer's, Parkinson's. Those things should be solved in the next 10 or 15 years. And many addictions also, the reward systems will be changed in the brain. But the neuroflexible part of the brain that's trained by cognitive therapies and by psychodynamic therapies can only be gained through study and through personal consciousness and awareness. And again, as you asked me earlier, a holistic lifestyle.
Okay, well, thank you very much for your interview. Is there any advice you would give to people out there who have been in therapy or who are thinking of going into therapy and have found themselves stuck?
Yeah, I would definitely add dialectical behavioral therapy and client-centered approaches to your toolbox of therapy so that you have a complete understanding and knowledge. Thanks.